Oh, I get that question a lot. What's the e-cigarette? The e-cigarette is actually not tobacco. They just call it the e-cigarette. What the e-cigarette is, it's something that simulates smoking. It contains some other kinds of chemicals, not tobacco though. For some people are touting the e-cigarette as a means of stopping smoking because it simulates the behavior of smoking. Still a bit controversial because some people are saying it has some other things.
Who have more of a trigger-driven problem to smoke.
Yeah.
Like passing a certain shop, you know.
Yes.
Like you're holding something, so it's like, okay, I'm smoking.
Yes. Clearly, for some people, I need something in my finger that's supposed to go into my mouth. So instead of using tobacco, why don't you use something else? But that's a bit of a controversial area because some people think we shouldn't replace a bad thing with another seemingly, bad
We'll come back to that in a minute. We've got to take a break. We'll be back shortly after. Stay with us. Welcome back. It's now time when you can call in and give us your views, maybe your experiences, and a question or two. Number to call is 01-2206-842. That's 01-2206-842. And we'll go back to the discussion. Now, should somebody coming to the clinic be thinking of a lot of money?
Oh, that's a good question. Now, this is at least the clinic that we run in Luth. It's a government clinic. It's not an expensive clinic. I think the card is maybe 500 naira or something. And let me guarantee you, we will treat you well. So it's a non-judgmental clinic. We're not going to come up and say, oh, why are you smoking? Do you want to kill yourself? No, we understand the fact that many people do have intense cravings and want to stop. And we're just there to help you.
Do you sometimes talk to the families of these people, maybe for more support?
Well, what we do is we encourage them to work with their families. We find that we have more success stories when the individual is not alone. Family being whoever is that important person around you. People tend to do better. There was a lady I met once who we had told, oh, you need to stop smoking. And for as much as you would think that she was stopping just because of her health, she was more concerned about stopping because her granddaughter said, Grandma, I want you to stop smoking. And that was enough for her. And that helped her. It helped her sometimes even more than saying, smoking the tobacco is going to kill you or something.
How could you smoke? You're a woman.
Yes, or how could
talking about women, you know, smoking, it would be more urgent for a woman who is pregnant.
Oh, yeah.
Tell us something about what happens to the baby. Does the baby have any effect in the womb? Does it have any effect on the baby in the womb?
Now, the first thing is what we need to know is that if a young girl is smoking and she's addicted to the nicotine in tobacco, it's difficult to assume that just because she got pregnant, she would stop. So what happens is if girls are smoking before they get pregnant, it's unlikely that pregnancy would cause them to stop. Now, what happens when they do decide to smoke while they're pregnant? Because pregnancy comes with a whole lot of hormonal changes, it stresses and everything, which if people are used to dealing with stress with cigarettes, they'll probably want to pick up a cigarette. What does that do to the baby? It clearly causes problems for the babies. The woman is more likely to have a child that's going to be low birth weight. The child is more likely to have developmental problems. In fact, the child is she's more likely to lose that child.
Okay.
And those children, over time, as they grow up, can also have developmental problems.
As in problems in school?
No, what we will say is developing. Yes.
Okay.
Yes. Because what you're doing is the cancer chemicals are going into the woman's blood, and we're bathing that baby with cancer chemicals. So, it's clearly not a good environment for a baby to develop. And women who are pregnant also need help. I don't think we should be judgmental and say, don't you know you are supposed to be stopping? You are pregnant. I think that we should just encourage them and encourage them to seek help. Yes.
Well, another reason people put forward for stopping is that smoking is actually bad for the economy. Can you explain how that is?
Yeah. The thing is, what happens is that because tobacco use is usually something that's addictive, there are many people who would rather spend money on tobacco than sometimes on very important basic needs. And this is particularly a problem for poor people, where that little amount that could have been used for maybe food children's clothes, school fees, and things like that might end up going towards tobacco. The other thing is tobacco. In fact, many countries in the world are beginning to realize that when you do control tobacco use, you are bringing down the health costs. Because many of the problems that tobacco causes are chronic illnesses, usually very expensive to treat.
Long term too.
Cancer is a very expensive ailment to treat, and many times, even after all that, the people might still die. Problems with heart disease also. These are also things that are very expensive. So if we have fewer preventable illnesses in the hospitals, clearly we would have more resources, yes, to spend on other things, So it's something that is a win for the country.
Well, do you think that legislation could help, and that's help people stay off cigarettes? Do you think, and what type of legislation would that be?
The evidence is clear. In countries where they have enforced legislation, it has brought down smoking rates. It's funny because in many developed countries, they've realized that tobacco is not good for us, and smoking rates are coming down. Unfortunately, the reverse is the case here. And we have like a bigger market, so this is probably more attractive, for tobacco industry. But the thing is, in countries where they have passed no smoking legislations, that on its own has brought down smoking rates. Also, higher costs, increased taxes. In countries where what they've just done is they've made cigarettes more expensive. So they've taken it out of the reach of some categories of people. When it's more expensive, young people are less likely to pick up the habit because it's out of their reach. You have fewer people taking up the habit, fewer people are smoking. So legislation clearly is important. In Nigeria, we've been trying to pass, Lagos State has done very well. They've passed some laws. But as a country, we've been trying to pass the Nigeria No Tobacco Bill, which we're still working on and hoping that the policymakers would give it some priority, hopefully, in the nearest future.
So what are the kinds of things that they will be saying, don't smoke in public places or stuff like that? I've heard something like, changing the inscriptions on the packet would help. Would they help? I mean, people hear all the time, you could die young.
Yes. Now, we've done some research, and what we found out is that, messages in words are not so effective. So now many countries are moving to pictorial warnings. What are pictorial warnings? Graphic warnings. A horrible picture on a pack that
We have somebody calling, Biodun. Let's take this first. Hello. It appears. Okay, go on.
Yes. I was talking about pictorial warnings earlier on. So I said pictorial warnings, instead of saying smokers are liable to die young, because we know that in this country, some people can't even read. So when you have a pack that says smokers are liable to die young, that doesn't make any meaning.
I hear that Biodun is still on the line. We'll get back to that. I'm sorry to cut in. Hello. Can we have your question? No, I don't think we're connecting. Yeah. You said pictorial warnings are a lot stronger.
Yes, because pictures transcend borders of language.
So what would they be doing? Putting skulls and crossbones?
Sometimes as bad as that. But what we tend to do is we take a picture of a health impact of smoking. So sometimes it's a cancerous lung. Sometimes it's a baby that's born small or a stillbirth. Sometimes it's terrible looking.
So you would recommend some of these measures?
Oh, clearly, yes.
And
they
some
work.
Countries actually doing
some
that?
Some countries are doing that. New Zealand has done so well, and I think Australia. Some countries have done that, and they've had remarkable results.
Then we should start.
Yeah, we should. We really should.
Okay. How do people get rid of? Okay, let me bring it down to specifics. Do they sometimes have to actually get rid of some of their friends? You want to stop smoking. You have friends who don't want to stop. Hello. Hello. Please go on.
Yeah, good afternoon.
Good afternoon. Your question?
Yes, I just wanted to ask Lady Doctor, But what of somebody that is taking coffee all the time? What does it causes in the body too? Because
Okay, I think...
I mean somebody that is taking coffee. Because like me, I've been taking coffee for a very long time.
All right, I think he's trying to draw a correlation between the nicotine and the coffee. Is there a connection?
I'm glad you asked that question. Tobacco contains nicotine. Coffee contains caffeine. The mix-up is always there. Some people tend to think caffeine is nicotine. They're not the same
They're
thing.
not the same.
Yes, so we definitely want to make that clear, that caffeine is different from nicotine.
So if there's a problem with coffee, that's for another day.
Yes, yes, yes. But clearly, coffee does not contain tobacco. So let me just make that clear.
Okay,
Yes.
we do have to close at this point. Thank you so much for coming. That was
Thank
so
you
interesting.
too.
Can't believe how the time flew. Thanks for being with us. You have a great day. I'm Mary Alale Yusuf.